Hi, my next guest is Elevate RT with Rob and Jeff. Hi, guys. Welcome.
Hi, Sherry. Great to be here.
Good. Can you tell me a little bit about yourself, each of you,
Sure.
starting with you?
I'm I started actually in fashion professionally, and then my wife told me I needed to get a real job after we had our first baby. And so about 20 years ago, I got into healthcare and became a nursing home administrator. And about 3 years ago, we started Elevate RT as a company.
Oh, now, is Elevate RT located here in Texas or are you located in another state?
Yeah, our headquarters are actually in California.
In California. Okay.
And can you introduce yourself?
Yeah, sure. I'm also a nursing home administrator by trade, I guess you could say. I've spent about 15 years in the nursing home industry and just joined Elevate RT actually 2 or 3 months ago. I'd known Jeff and got introduced to these guys and just really loved the mission and everything they're doing to help the pulmonary wellness of patients in nursing homes.
So, what drew your company to partner with OPCO?
Yeah, good question. I got a call out of the blue from Saul, the owner of OPCO. We had had a lot of success with some of the facilities in California and then Texas with our respiratory therapy program. And he'd heard about it from another owner and operator that we worked with and said, "Hey, Jeff, I hear you're doing some pretty amazing things with respiratory health and skilled nursing. I want to learn more about it." And so I said, "Yeah, happy to talk about it." After a quick call, he set up a meeting with Dr. Obi and the rest of the team, and they were all excited, and we're off to the races after that.
So, how does that work? So, if you have a patient who has a concern with their respiratory, do you have a team that goes in to see that patient? Can you tell me like how that works for
Yeah.
a patient staying in the skilled facility?
Yeah, great question. So you mentioned having asthma.
Yes, I do have asthma.
So does my
I
wife.
hate to say it, chronic asthma.
Yeah, and it's tough to manage,
It
right?
is. Now I have it under control.
Good for you.
But it is. It is tough to manage. I definitely can agree with that.
Yeah, and same situation for a lot of these patients in the nursing homes, except even more severe. They'll have COPD,
Mhm.
chronic pulmonary conditions, CHF. And the sad thing is, in most nursing facilities, it's tough to manage those respiratory conditions for these patients. So our group, what we do, the partnership with OPCO, is to introduce a full-time respiratory therapist, 7 days a week, 12 hours a day, to address these specific concerns head on. That's the short description of what we do.
Wow. Can you tell me what makes OPCO's approach to skilled nursing care unique and different in the industry?
To my knowledge, we're the first company of our kind. Most skilled nursing facilities don't have access to full-time respiratory therapists.
Oh, they-
And the challenge that most patients have is typically our approach to respiratory health is fairly reactive. We'll have a patient who's not breathing well, give them a PRN breathing treatment, inhaler or bronchodilator. If their oxygen levels dip, the common scene you'll see in a nursing home is the nasal cannula with the oxygen supply. But unfortunately, neither of those address proactively what's really going on with the respiratory health of patients. And that's where we come in. Our respiratory therapist will work closely with the physician, pulmonologist to introduce a more proactive approach to respiratory health. Modalities like deep breathing exercises, chest physiotherapy, and other exercises that can allow the patient to now take a more proactive role in improving their respiratory condition.
So, does your company come in and also meet with the family like one on one and talk through the care plan that you set aside for their loved one?
Yeah, another great question. So they're there 7 a.m. to 7 p.m., 7 days a week, working with patients, communicating with families, updating the care plans. And so a lot of that is that communication. It's interesting. I just saw the other day a respiratory therapist use a great analogy with a family member who was getting a little impatient with their dad and their respiratory condition, saying, just breathe harder, try harder in the therapy. And the therapist, to their credit, pulled out two straws. One was like a big gulp straw, the other was the little red coffee straw, and handed it to the family member who was getting frustrated. Asked him first to take a breath with the normal straw, breathed in and out fine, and then passed them the little coffee sipper, said, breathe into that. And of course, they struggled. and said, that's exactly what your dad is feeling every time they take a breath. And I think it was the first time that it really clicked for the family member that, oh, this is harder than I thought it was.
I'm glad that you're saying that because my husband needs to hear that too. So when I'm suffering.
Yeah, it's hard to relate. If you breathe normally, you take it for granted. But I'm sure you've experienced in moments where you can't breathe normally.
I can't. And I
It is
feel like I
scary.
weigh 360 pounds and I can't. And every step that I take, it's harder. And then I start wheezing. Yeah, it's difficult. I'm glad to hear that you guys have therapists in there 7 days a week to support those patients. It's so important because when you feel like you can't breathe,
You can't do
you
anything,
can't do anything.
especially in a nursing facility.
Yeah.
When they can't breathe, it's hard to get to the restroom. It's hard to get to activities. It's hard to exercise. So what happens? They spend a lot of their time in bed, scared about having to get up and worry about that breathlessness. And our goal in our program helps them to breathe better, to really just breathe new life into the patient so that they can get back to doing the things they want to do.
That's so important. How does your team collaborate with directors of nursing, physical therapists, and the administrators with the OPCO building?
Yeah, so we start off working really closely with the DONs to do a full assessment of any patient with a respiratory condition. Again, we're trying to gauge what individual plan can we develop that could help them in any way. And so there's a close partnership first with the clinical leaders, the physician, to develop that individual plan of care that you described, to take a look at what's going to work best, what exercises for the breathing, what chest physiotherapy is going to help loosen those secretions, prevent pneumonia, what other modalities do we need to consider that the patient can benefit from. And then the second part of your question with physical therapy is a great one because for many of these patients, when they can't breathe, they can't do physical therapy.
Right.
They'll tell their therapist, I'm sorry, it's too hard, it's too scary. But as they start to make gains with the respiratory therapist, typically after 2 or 3 weeks, and they say, hey, I'm feeling better, I'm breathing better. It's a great opportunity to then reintroduce physical therapy and say, hey, I think Sherry's ready for some exercise again.
Hey, I got a quick question for you. So, would you say the Stairmaster is not good to be on to do more aerobics? Because I like the Stairmasters. I'm just asking that question.
Any exercise is good exercise as long as you can tolerate it,
Long.
right? For some of the patients in nursing home, that's probably a little bit beyond them. But when they get there, yeah, getting the heart rate up at an appropriate level, allowing that oxygen exchange is so important to respiratory health. So you keep doing the Stairmaster. It's a good exercise.
That's a good.
I want to thank you both, Rod and Jeff. Thank you so much. And I want to let you know that OPCO values the partnership that they have with you. So thank you so much for taking the time to sit down with Synergy Innovators.
Yeah, you're very welcome. Great to be here.
Thank